Hi, I'm Jay Mehmet, and this is a brief presentation that basically answers the question, what is a needs assessment? First question is, when do you conduct a needs assessment? Most importantly, it needs to take place before any activity is designed or carried out. So why do you conduct a needs assessment? The purpose of a needs assessment is to make decisions regarding priorities for a program or an agency or an organization. So needs assessments are about evidence. So can you answer these questions? What evidence do we have that our audience needs X? What evidence do we have that our solution will yield positive results? What is the reason that we are offering Y in this particular format? All of these things are questions that can be addressed by a needs assessment. As noted by our former President Bill Clinton, it depends on what the meaning of the word is. So definitions, not just in needs assessment, but in a lot of areas of social work practice, are crucial. Here are some key concepts that we associate with needs assessment. Gaps. So a gap is simply the space between what currently exists and what should exist. Needs are contributing factors. What needs to be resolved to help close the gap? Needs often relate to barriers or obstacles. Wants are possible solutions, a proposed means for filling a gap. And then assessment is the evaluation of needs, barriers, and resources. So a needs assessment is quite simply the process of identifying and measuring areas for improvement in a target audience and determining the methods to achieve improvement. So what goes into a needs assessment? Normative data, evaluations, goals and objectives, opinion, timelines, barriers, and resources. There are basically three stages to a needs assessment: what's called the pre-assessment, then the actual assessment, and then the action plan. In the pre-assessment stage, basically, you want to ask the question, what do we know already? So this is the foundation of what is called a gap analysis. So what is the current state of affairs? Where should we be? How does our region, our organization, our community compare to others? What's new? What's important? The assessment is the evaluation of the data. So we're asking questions such as, what are the barriers, both internal and external? What needs have we identified? Are some gaps bigger than others? Consider both the scope and the severity of gaps. What are our priorities? Do we have the resources to address them? And why do anything at all? With regard to the action plan, you need to ask the question, how are we going to translate what we have learned into what they need? And they can be members of an organization, an agency, a program. It can be clients, consumers, patients, service users, whatever. Which needs can we address? How are we overcoming barriers? And you want to list additional barriers that hinder progress, and then have any areas been identified for follow-up or future opportunities for intervention. In terms of gathering data, you want to search for objective measures and attend to scope and context. So the concerns you have is how many or what percent of patients, clients, consumers are exposed, vulnerable, or expected to suffer from. The magnitude and the severity. What are the consequences? The level of discomfort, the level of pain, the level of blindness, and I mean this metaphorically. Duration, frequency? Are there national standards or best practices? Can we do better? And then if we decide we can, how can we do better? Just a side note on epistemology, which is how you know what you know. Needs and gaps are identified in 4 ways: normative, relative, expressed, and perceived. So looking more specifically at types of need, normative needs are defined as falling below a standard criteria established by custom, authority, or general consensus. So the strength of this is that it allows planners to use objective targets. A weakness of normative data is that need levels change with time and must be reevaluated. In terms of relative needs, they are measured by the gap between the level of service between similar communities. The strength of this type of need is that it can lead to a priority for distribution of limited resources. A weakness is that it limits resource allocation to underperforming areas. Express need is defined in terms of the number of people who actually have sought help. And the strength of this type of need is that it focuses on situations where people have taken action, and it helps to determine barriers. A weakness of this type of need is that not all people with needs will seek help. And then there is loss of the bigger picture, and then it tends to miss latent needs. And then finally there are perceived needs, and this is defined in terms of what people think their needs are or feel that their needs should be. The strength of this is that perceived needs and data surrounding these types of needs are easy to come by. A weakness is that it tends to be very subjective, and it is subject to the Dunning-Kruger effect. Translating problems into needs is dependent on the type of need itself, because each need paints a different picture of the gap. So remember, wants and needs are not the same. A needs assessment is conducted before the activity is planned. A pre-assessment is not enough. And the more types of needs you consider, the richer, the more robust the planning process, and the more effective the effort, which may be education, it may be training, it may be some type of intervention, whatever. Okay, and remember what Peter Drucker says: what gets measured gets managed. If you have any questions about this short presentation, you can email me at j.memmott@usd.edu, or you can call me at 605-357-1592.